Thank you, Patrick. Well, people with age-related macular degeneration, or AMD, lose the central field of their vision, making objects look blurry. There are both wet and dry forms of AMD, but for patients with the dry form, there has been no approved medical treatment. Now, researchers are testing a gene replacement therapy that may save or even improve eyesight. Marty Salt has more.
Sherry McDaniel turned her love of baking into a thriving business. But as her vision began to blur, running Miss Sherry's became a challenge.
There you go. When customers would walk in, I would not be able to distinguish their facial features.
Look up for me.
Doctors diagnosed Sherry with the dry form of age-related macular degeneration. Dr. Christopher Riemann is among a handful of retinal surgeons testing an investigational therapy for dry AMD called OpRegen, a one-time replacement of human retinal pigment epithelium, or RPE cells, done under local anesthesia.
We're taking a slurry of those cells and we're injecting them into the space under the retina where they're missing.
Just a few days after the injection, Sherry noticed a difference in her vision and called the office.
I could see without using my magnifying glass because I was just so excited.
We're always very alert. If a phase 1 patient calls and I'm about having a heart attack, you know, what did we do? What's going on? And she's crying tears of joy.
Dark roast or medium roast?
Doctors aren't sure how much vision Sherry will regain, but for starters, the improvements mean she can help behind the counter of her namesake shop without a struggle.
If it can help me, and then next time it'll help somebody else, and it keeps on going, then there you go. And there we go, Miss.
I'm Marty Salt reporting.
Sherry McDaniel sold Miss Sherry's Donuts a few years ago when she and her husband were both having health challenges. Her friend now owns the shop and has kept the original name, and Sherry still shares her recipes. OpRegen is being tested in a phase 1-8 clinical trial to determine safety. So far, researchers say the treatment has been well tolerated.